Dance disappears almost at the moment of its manifestation. It is an extreme expression of the present, a perfect metaphor for life. We embody both the dance and its disappearance. We spend a lot of time in healthcare gathering data, analyzing data, looking at scans, managing technology. And while that's all important to be able to provide evidence-based practice and evidence-based healthcare, that technology can sometimes get in the way of a real connection with our patients and families. And so this community of practice in the Department of Family Medicine, led by Dr. Joyce Zazeluk, has really connected a group of health professionals who are interested in stopping and listening in a new kind of way, a different kind of way, in some ways going back to the legacy of William Osler.
Sir William Osler was a native of Ontario and lived for a considerable part of his youth in Dundas, and really was one of the first humanists in medicine. He was the person who, I think folks today would use the term, a patient-centered physician.
He was the first to say that becoming a good doctor isn't about sitting in a room somewhere, piling through lecture notes and learning the names of bones and muscles. Important work, but not sufficient for doctoring. And he said learning then has to move to the bedside of patients, to their actual lived experience of illness, and we needed to honor the patient's story to be good at our job.
Medicine in the 21st century is evolving. As our understanding of disease becomes more and more complicated, the old concept of a single physician looking after a bunch of patients in his or her office with one assistant, that model we're moving away from that model. It really is about a team, and we're trying to embrace and incorporate all members of the team within the care process.
What I've really enjoyed about being a part of the Department of Family Medicine is their incredibly creative approach to medical education. For about the last 3 years, I've been a member of a group called the Narrative Medicine Community of Practice. And this is a group of interdisciplinary health professionals, physicians, nurses, people like me, ethicists, social scientists, who are interested in exploring and in some ways reintroducing the element of storytelling and story listening into the healthcare encounter.
Patients also tell stories in ways that aren't always around words. So sometimes the story they tell is through their bodies, whether that just be with body language or the symptoms that their body decides to present to me that day.
The more I dance, the more I realize that you can say a lot in a gesture that would be very difficult to capture in words. A very simple gesture like this. How do you say this? How do you say this in language? It might be I love you. It might be I feel you. It might be I'm safe. Through movement, through gesture, we have a much wider vocabulary of what we can say than in the constraints of language.
I have been part of a group looking at the role that art in various forms plays or can play in the education of physicians. So it was through my involvement with that group that I came to know about this particular dance work. And so my interest in it stemmed from trying to understand what the possibilities are for the use of dance in teaching physicians.
For us, the opportunity came when the McGovern Foundation allowed us to use some of grant money to put on an Osler lecture. And instead of doing the traditional Osler lecture, which is a single person giving a talk about an aspect of medicine, including snippets of Osler's life, we thought we would try and weave a little bit of Osler's teaching and life into something perhaps a little bit more reflective of what we're trying to accomplish in family medicine, which is really trying to integrate the community into our teaching, into our practice. I think when the first idea, though, was pitched to me that we're going to commission a dance about doctors and patients, it was a little bit eyebrow lifting, and then the idea was to bring in the live musicians, because that really is a part of the experience.
So for me, dance is the art form that most closely imitates life. It only exists in the present, and it exists in the body, and it exists in relationship, in a dynamic relationship between myself and the bodies of those around me and the space that we inhabit collectively.
Another colleague and I role-played with Andrea a doctor-patient interaction. They filmed that and then basically took it apart bit by bit, or unpackaged it, and began to then interpret what they saw happening in that interaction in dance moves or in a dance sequence.
Your arms would, to help him, would be there.
The technique is always in service of the story. So when we're working together on a piece of choreography, we're not going for pretty. We're not going for beautiful. In fact, there are times when we'll say, you know what, that's kind of pretty. We're not wanting to soothe the audience with a beautiful aesthetic. We're trying to connect with the audience emotionally and tell a story that matters. If you write a story or tell a news story, you're always quoting one person against another, or you're telling the story from only one perspective. In dance, you can tell it from multiple perspectives simultaneously.
How long has this been going on?
I think just the department's capacity to keep learning and to keep improving things for our patients has been widened by our willingness to partner with folks who are new to us and that we've never worked with before. So it's just been tremendously exciting and invigorating to have these collaborations. And now we have this fabulous event to look forward to.
There are 3 pieces that we're showing as part of this showcase sponsored by the Department of Family Medicine at McMaster. The first piece is called Body of Work. The piece begins with, in some ways, my collected works of some of the most challenging and difficult ethics cases that I've experienced in my career, and we tell the story of those different cases. And we also tell the story of the impact of those stories on me as a healthcare professional. And so it's in some ways a celebration and an acknowledgement of the body as an intrinsic part of the identity of the healthcare practitioner. The second piece is called Exam Room Adagio. It was originally commissioned by the Department of Family Medicine in 2012. This story is about both the emotional terrain of the physician who is entrusted with the health and well-being of members of his or her community. And it's also about the trust that is required from a patient to enter into that relationship, to open up to someone, to share one's life and life story with a physician.
I was fortunate enough to be in the audience for 2 of the productions, the first time that they were performed. For me, it tapped into something I'm not sure that I knew was there completely, and I think that had a lot to do with the medium being dance. It really showed as much about, you know, what the physician's kind of hopes and desires are for the visit with the patient, as much as what it's about for the patient, in a way that's really, it's always just subtext. You know, these aren't words that are really spoken with patients, but you realize how intimately connected you are.
The third piece is a world premiere. It's a piece, again, commissioned by the Department of Family Medicine. It's called Intraoperative. A healthcare crisis takes on an operatic quality. Opera is very much about melodrama, very much about passion, very much about relationship. So this is a piece that explores the impact on a patient and family of a health crisis, and explores the emotional terrain of how a patient and family navigate that health crisis together and separately.
Our hope is that when folks come and watch this, they're actually going to be moved. They're going to learn something, perhaps. They'll learn something about themselves. They'll learn something about, hopefully, family medicine.
Having had my own experience of the dance company, I know how personal and intimate that can be, and I know it changed how I understand my role as a physician and how I understand the work we do with patients.
In many ways, it showcases what I see as a real opportunity for 2 of the primary, I would say, creative and economic engines of Hamilton to meet and collaborate. So we talk about art being the new steel, but we also know that it is healthcare that is the #1 employer in Hamilton.
The community is a part of it, so we're purposefully doing this not on the university, but trying to do it downtown within our community. And as we build new clinics and we start to build team-based clinics, those need to be situated in the community. And the community, members of the community, really need to guide us, inform us, and be a part of the healthcare process.
To be downtown and to be at the center of Hamilton and the revitalization of Hamilton is something we're tremendously excited about. We're going to have partnerships with key folks like public health and nursing research colleagues and learners from all the disciplines in the health sciences. So already we're looking forward to being part of a bustling neighborhood. So I'm really hoping this event signals the fact that family medicine is tremendously proud to be moving downtown to be part of Hamilton. And also we're willing to try some new things. We're willing to challenge convention in some gentle, collaborative ways, which we hope really entice people.
It's a department that really is pushing the envelope around how do we think about training the next generation of healthcare professionals so they have both the technical skills but also the emotional skills to navigate what is an increasingly complex healthcare system, and that they continue to find connection and meaning in their work day after day, year after year, and decade after decade.